Welcome, everyone. My name is Katie Drasser, and I'm the Managing Director of the Aspen Global Innovators Group at the Aspen Institute, which, along with the Health, Medicine, and Society program, hosts Aspen Ideas Health. I want to thank you all for joining us today. While the pandemic has prevented us from gathering in person, we are excited to continue to learn together through inspiring conversations between leading health practitioners, advocates, artists, scientists, and innovators. Today, we are very honored to be hosting this conversation about the need for diversity in the healthcare workforce between Dr. Uche Blackstock and Dr. Lippy Roy. This is the first time they've ever been in conversation together, so we're thrilled. As an emergency medicine specialist in New York City, Dr. Blackstock has seen firsthand how this pandemic is highlighting the disparities that have long existed in our health system and she's proactively working to create systemic change. Dr. Blackstock is joined with Dr. Lippy Roy, who has expertly reported on the lack of diversity in medical schools and has been on the front lines addressing a range of health inequities over her career. So let me briefly and properly further introduce these two amazing women. Dr. Blackstock is a thought leader and a speaker on health inequities and racism in healthcare. She's the founder and CEO of Advancing Health Equity, which partners with healthcare organizations to address the critical factors contributing to health inequity through talks, workshops, and consulting services. In 2019, Dr. Blackstock was recognized by Forbes magazine as one of the 10 diversity and inclusion trailblazers you need to get familiar with. She was formerly an assistant professor in the Department of Emergency Medicine and faculty director for recruitment, retention, and inclusion in the Office of Diversity Affairs at NYU School of Medicine. Very impressive. Dr. Lippy Roy, equally impressive, is an internal medicine physician board certified in addiction medicine, as well as MSNBC and NBC News medical contributor. She currently serves as medical director of COVID isolation and quarantine sites for Housing Works in New York City. Dr. Roy also serves as clinical assistant professor at NYU. As the former chief of addiction medicine for New York City jails, including Rikers Island, Dr. Roy oversaw substance use treatment and recovery services. Previously, she was a primary care doctor to Boston's homeless population, while also serving as an attending physician at Mass General Hospital and faculty at Harvard Medical School. So Uche and Lippy, we're so happy to have you both here. Thank you both so much. And I'll turn the mic over to Lippy. Take it away.
Thank you so much, Katie, for that lovely introduction. And thank you, Dr. Uche Blackstock, for taking time out of your hectic schedule to join us for this really important discussion on the need for health equity and a diverse healthcare workforce. So I'm just going to jump in, and I'd like to start by asking you, Dr. Blackstock, to share a bit of your background as a second-generation physician, your experience as an academic medical center faculty, and why you founded Advancing Health Equity. Take it away.
So thank you so much for having me, and I'm so excited to be in conversation with you today, Lippy. So, my background actually has very much shaped the path I'm on right now in terms of the work that I do. My mother is the original Dr. Blackstock, and I think, being a Black woman, that is a very rare thing to be able to say. She grew up about 10 minutes from where I am right now here in Brooklyn, New York, under very different circumstances than I've grown up in. She grew up in poverty to a single mother. She was the first person in her family to go to college. And she ended up having a chemistry professor who encouraged her to apply to medical school. It was something that she had not even considered before. And she ended up being accepted to every single medical school she applied to. And so she matriculated at Harvard Medical School. But the thing about my mom that I really learned from is that after medical school, she came back to her community here in Brooklyn, New York, and practiced for many years. She also worked at our county hospital and mentored younger junior faculty as well as students, and her patients really, really admired her. Unfortunately, she passed away when I was in college. Both my twin sister and I were in college, and my sister's also a physician, but obviously she's influenced us tremendously. And so I went into academic medicine really excited about doing diversity work And, I can talk a little bit more about my experience, but I realized that really in order to do the work I wanted to do around diversity, equity, inclusion, as well as anti-racism, that to do it externally would probably be more effective than doing it within institutions, because as we know, institutions are sometimes very difficult to change from the inside.
Yeah. Well, first of all, I think that's just all remarkable. Katie alluded earlier to the fact that you and I have never actually spoken in person, even though I've interviewed you for a Forbes
Yes.
article, and I've written about, and we're going to talk more about this, about the need for more Black women in medicine. And this, of course, can be expanded to more underrepresented individuals, which
Right.
includes women of color. But, it's interesting. In my immediate family, I don't have any doctors, but outside of that, lots of uncles, aunts, cousins, grandparents, and this idea of connection to our own family and how that shapes us is really important. So I think that's important for the viewers in the audience to really, I'm sure it'll resonate with many viewers. So, as you know, Uche, and all of the viewers know, we are living through a new normal and very challenging times because of COVID-19. And it's been said many times that there's nothing like a pandemic to expose the existing cracks in the US healthcare system. So from your perspective, how has this current coronavirus outbreak highlighted or reinforced the need to address health disparities and inequities? And why is diversifying the healthcare workforce a key element to advancing health equity in the United States?
Yeah, so thank you for that very thoughtful question, and it really is the basis for the work that I do. So, one of the reasons why I founded Advancing Health Equity was because there were significant pre-existing racial health inequities even prior to the pandemic. I talk about often in my talks and trainings that we've heard about the Black maternal mortality crisis that has gotten a lot of press over the last few years, but there's also an infant mortality crisis with Black babies being more than twice as likely as white babies to die within their first year of life. And that's a wider disparity now than it was 15 years before the end of slavery. We also know that Black men have the shortest life expectancy. And so, we knew that, communities of color carried the highest burden of chronic disease even before the pandemic. And I know that even in my own work, my clinical work, I still work part-time in urgent care, that at the beginning of the pandemic, I noticed how my patient population had just shifted from a very racially and socioeconomically diverse population to mostly Black and brown patients. Many of them were essential workers and service workers. And I just saw with my own eyes, who this pandemic was impacting the most. And so I think, as you've mentioned, the pandemic has unveiled these profound inequities that have always been there. We're just seeing them in a more stark fashion. And we're seeing Black, Latinx, and Indigenous populations being decimated by this virus.
I'm so glad you shared your own personal as well as your own professional and academic experiences. Unless there are folks like you and I who work with these populations, with these individuals in these frankly broken systems, it's hard for people to really understand that. And I'll be honest, I was born and raised in Toronto, Canada, to traditional Indian immigrants. I had a good upbringing, but it wasn't until I actually moved to New Orleans and I did all of my medical training in the South that I realized, wow, there are deep-seated inequities in this country, which as a foreigner, I was very, very new to me, but it needs to be addressed. So, and I think through storytelling, through data and storytelling, that's how we get this across. So thank you for sharing that.
Can I share a story I just wanted to share a story
Please.
from a few of my patients that I saw during the pandemic. I remember there was an older an elderly Black man who came in with COVID symptoms. He had COVID pneumonia. I wanted to send him to the emergency department. And he said to me, "Doc, honestly, I'm scared to go there because I don't think I'll be treated well." And essentially he meant that as a Black man, he did not think that he would get the care that he deserved. And what we have seen in the data from the pandemic is that there are disparities in care depending on which hospital you go to, right? And that there may be some accentuation of, provider bias. Everyone's working under a very stressful situation. And so these were valid and just concerns that this patient had. I was glad he was able to express them to me and we were able to have a conversation about it.
Yeah. Well, and you just mentioned another key really gap or issue, and I'll get to this as well. But what about us as physicians and as healthcare providers, our own conscious and unconscious bias? So, well, that's going to lead me to this, my next couple question, actually. We know that Black and Hispanic individuals now make up about 30% of the US population, yet only 15% of first-year medical students. So what gaps in the physician pipeline are preventing more minority students from pursuing careers in medicine? And what changes do you think need to happen in academic institutions?
Yeah, that's such a great question, and I think this is something that I've been in conversation with a lot of people in groups about recently, because again, the pandemic revealing these inequities and us knowing that a diverse workforce is one, not the only solution, but one of the solutions to addressing these inequities. But what I will say is that I think people need to understand that the same problems, racism that has led to these racial inequities are the same. It's the same problem that's leading to the lack of Black physicians. Because remember, the social determinants of health, employment, education, transportation, all of that is important to developing communities. If you don't have opportunities for wealth to accumulate wealth, right? How can your family ever afford to send you to college? If you live in communities that have been disinvested in, and you have never met someone who is a physician, right? You have no one to role model against.
Right.
If you're going to chronically underfunded schools that offer, unfortunately, a poorer quality education that may not even prepare you. And so often I talk about this pipeline has to start from kindergarten. I even think college, being pre-med, is too late. I think even high school is too late. We need mentoring. We need resources going into schools in underrepresented communities, starting from the very beginning, targeted, intentional programs that really help support students all the way through the pipeline.
Well, I agree, because because if you start targeting at university level, you've already missed the goal point, because studies already show that young girls, at age 10 to 12, they already show a disinterest in math and science. And it's not that they're not good at it, but if they have a certain struggle, they are almost dismissed right away, right? Whereas more attention is paid maybe to the boys, or the girls are diverted to other areas. And I'm just using that as an example, but you're absolutely right. And we have data to support this as well. Right. So right. I think I 100% agree with you there. There's also been discussion about, beyond creating diversity and inclusion task forces, what other meaningful actions, say hospitals and health systems, can they take to support minority physicians and to combat gender bias and racism? I think the latter is something both you and I have certainly experienced right. ourselves.
Yeah, and that's such a great question. And, what's interesting is, in my own experience in academic medicine, I got to see sort of firsthand what it's like to be a Black woman physician within academics. And some of the things that I learned from that experience is, yes, while these task forces can be useful, they really are band-aids, right? What we need is buy-in from institutional leadership. We need to have, CEOs and deans of medical centers and medical schools who really legitimately care about these issues and understand that if you have an equitable working environment, that's going to trickle down to the care that you provide. And so I think that, these values need to be instilled in strategic plans. It needs to be part of every leadership person's role, not just the chief diversity officer, right? That shouldn't be the only person thinking about diversity, equity, inclusion, or anti-racism. It should be within everyone's roles and responsibilities, because I think what happens is, you say, oh, that person's dealing with it, it's not my problem. And no, it really should be all of our problems. And then I think we need to review practices and policies within institutions to see how do they create bias and racism and sexism, right? Because we know these policies, whether intentional or unintentional, do that. So there needs to be more intentionality at every step of the way within these organizations.
Yeah, what a really great response, and I like the idea that you said that it has to start at the top with the individual, but then also I'm thinking of, like, when I think of every major hospital and academic center, when you look at their website, you can see their mission statement and then their values. So it needs to be stated on a very large scope from there. And then, of course, at the very detailed and very nuanced level. I agree. Otherwise, you're just not going to get change happening. And I totally agree. You
Right.
have to have that buy-in from people that are in decision-making positions.
Oh, absolutely. Because if the leadership has not, it doesn't support these values and priorities, and what message are they sending to the rest of the organization or the institution, right? It doesn't matter how many task forces you have if you don't have the funding and the resources.
Yeah.
You know, nothing is going to change.
100%. So I'm curious, Uche, what advice would you give to a young Black woman looking to pursue a career in medicine today? Again, you can tailor it to a specific to a Black woman. What you can expand that to women of color, women in general. I'll let you have that floor.
So that's another interesting question. I will say that the journey that I thought I would take as a physician has been very different than the journey that I'm currently on. I thought that I would stay in academic medicine for the rest of my career. But I'm actually creating this path that I really don't have that many other people in front of me to leave academic medicine. I was just promoted last year to associate professor. And people thought I was crazy when I said, I'm leaving to start an organization that focuses on addressing racial health inequities because I feel like this is important enough. People looked at me like, what are you thinking? And so I think my message, not just to a young Black woman thinking about medicine, but really any physician that really wants to do advocacy and even social justice work, and that your future may look different than what you thought, but you really have to take that leap of faith. If you believe in your mission and you walk that path, then everything will ultimately work out.
I love that response, and that resonates so strongly with me as well. Because if you told me, forget 10 years ago, 5 years ago, oh, Lippy, you'd be in New York City and you'd be on national television and you'd be talking to Dr. Blackstock about advocacy, I'd say you were insane in the membrane. Because, I had never thought that my path would go this direction. And, my message would be, there's nothing wrong with that. There's no right or wrong. Life just has different ways of putting different, I wouldn't even say obstacles, but rather opportunities. And sometimes you just don't know it at that time that it's going to be an opportunity, right?
Absolutely. Like, sometimes you'll have disappointments, professional disappointments that actually turn into really wonderful opportunities in retrospect. And so I would say maybe, not be so rigid in terms of, knowing everything you're going to do every step of the way, but really being open to experiences and opportunities that can help shape your path and your journey.
Absolutely. So in the remaining few minutes, there's a couple questions I do want to get your input on. So I often remind my patients that they have the power to improve their lives, education, encouragement, help them feel empowered. So what specific advice or tools would you give to viewers to empower them individually in addressing inequities? Because one need not be a healthcare professional to make a difference, right?
That's such a great question. And I think one concept that I've been studying a lot lately is this idea of structural competence, sort of moving away from cultural competence to structural competence, understanding how the environment at the neighborhood level shapes a patient's health essentially, and seeing that even as a clinician, even as a non-clinician, if you are involved in job advocacy groups, housing advocacy groups, educational nonprofits, really those are ways, because those are social determinants of health, those are ways that you can help address health inequities, even with a donation, or even engaging with community-based organizations. I think is so critically important. So there are ways that we can be advocates, even as individuals.
Yeah, I think that's so great, because I just believe in empowering you. We need the entire community to be part of this discussion, right?
Absolutely. That's the only way we'll end racial health inequities. The only way.
Exactly. And the idea here is not to exclude other groups. Like, we're not excluding white people, we're not excluding men. It's about being inclusive and how to engage them in this conversation in a way that they actually also feel really helpful and empowered, because they should be as well. But it's about listening I think it's really about listening non-judgmentally too, right?
Yes, yes, listening with an open mind, not making assumptions. And, I always talk about a growth mindset, coming into situations with a growth mindset, knowing that none of us are fully formed human beings, that we're going to really be learning new content that will actually shape and change our perspectives and opinions.
Exactly. And so the last question I want to ask you, Uche, is in this day and age, and this is a question that I was asked when I was giving a talk, I think in Anaheim, California, a couple of years ago. And ever since she asked me this, I have now not only incorporated my talks, but I now want to ask this to other
I need to
audience
write
members.
this down. I need to write this down.
Well, in this day and age, especially right now, of constant stress, uncertainty, unemployment, racial strife, sleepless nights for all the many reasons I just listed, what do you do as a medical professional, as a woman, as a mother? What do you do for self-care?
So in full transparency, because I think this is so important, I have an amazing therapist. I have bi-weekly appointments with her. I just had one a few hours ago, and just making that time for myself to talk to someone who, again, is non-judgmental, who is not, significant other or family member, has really been so incredibly important to my mental health and to my self-care. And so I would say, definitely that's one of the things I do. I try to work out regularly, but having a therapist is one of the things I've done for myself that, I'm very proud of.
Can I just say that as an addiction medicine physician, I am so glad that you so openly stated that, because we need far more people to just be open about what they're going through mentally, emotionally, psychologically. Seeing a therapist is not a sign of weakness. It's actually a sign of self-care and empowerment. So thank you for saying that. I'm also going to add that I do also try to exercise, work out. I try to make a fruit smoothie in the morning. I try to cook and eat healthy. I meditate every morning. I have a gratitude journal, but I talk to people who I trust. I don't keep things bottled up inside.
Right.
And I think that's all really, really healthy in this day and age when we just all have really stressful lives, particularly during this pandemic.
Particularly.
So,
I think we need to acknowledge that. Yeah, I think we need to acknowledge that it's a really difficult time for everyone.
Absolutely. Well, thank you so much, Dr. Blackstock, for taking time to join us for this incredibly powerful conversation. I'd now like to open it up to questions, and thank you to the amazing Aspen team for going through all these amazing questions. So one question from the audience is, how can we bridge the rural-urban gap on the urgency of racial justice?
Yeah, no, I think that's a great question, because I think there was a recent report that came out that I think people don't realize, but there are many Black, Latinx, Indigenous people that live in rural settings as well. And then also there are also, our white counterparts who are lower income that also live in those settings and that have to really experience a lot of the same health issues that people in urban areas do. So I think there needs to be a lot of education around that. And I think, while things may look different, there may not be public transportation, and that's one of the risk factors for, prevalence of coronavirus. There are other factors that we need to consider. So I think absolutely that's an area that needs more discussion and study and advocacy around.
That's great. Another question is, how can we be sure to diversify the pipeline of various healthcare and emergency profession programs other than physicians at the certificate and associate's degree level, say like EMTs, paramedics, medical assistants, and how do we educate students at the high school level or even earlier who may not know about these positions opportunities? You kind of touched on the latter a little bit, but go ahead.
No, I think that's such a great question, because I think people need to realize, like, being a physician is not the end all be all. I am like a physician assistant, advocate, our paramedics, our EMTs, we are all integral to taking care of people. So, as I mentioned earlier, I think exposing our young people to these potential jobs and careers early on in their life is important. I think mentorship and sponsorship programs are also important. But I think we also need to recognize that, you know, students from our communities may not have the financial resources, and so we need to incentivize you know, our young people to go into these professions as well. So, you know, subsidizing you know, education and training in these jobs and professions.
Yeah, and I think my response to at the high school level, if not even earlier, like middle school level, is you know, what it goes back to that expression: if you can see it, you can be it. So
Right.
having guest speakers like you, me, and others, you know, in these and nurses, but people from all allied healthcare professionals, as you pointed out, like I can't do this job without working as a team, and I rely so heavily on other people in the team: the counselors, the therapists, social workers, obviously
Right.
nurses and other doctors. Let's, oh, we have time. So another question from the audience: how important is it to have physicians of color leading outreach to communities of color around COVID-19, especially as it relates to clinical trial recruitment and vaccine adoption? I think that's a good one.
Such a great question.
It's so
And I
relevant.
would, yes, and I would say that, you know, I don't want it to seem like you have to be a physician of color to do outreach.
Right.
Definitely, it probably will be easier for physicians of color to connect with community members. However, what I think is really important is for not just physicians, healthcare professionals, institutions to connect with community-based organizations that are already on the ground doing this work, that are led by trusted individuals, because that is what is key. So whether it be churches, neighborhood coalitions, YMCAs, that really the need is to connect with trusted individuals who will then help to do outreach and education around trials and vaccines, because as we know, the history is a very horrifying one around the exploitation and abuse of communities of color. And so I think that, you know, resources and intentionality really need to be put into these efforts, because we know that we need diverse and adequate representation in our clinical trials, especially of this vaccine.
Yeah, I completely agree with that response. And the viewer asked, it was a very astute question, because the reality is that clinical trials still very much focus on, it's not as bad today as it was, say, 20, 30 years ago, but white and male. And so we definitely need to diversify that. And I think it's our responsibility as a society to do targeted outreach to
Absolutely.
communities to make sure that they're represented, and that we need to earn their trust.
Yes. Oh, absolutely. You know, I've been working with some pharmaceutical companies around this, and so it's great to see. I know Moderna and Pfizer are both trying to do some targeted outreach to communities of color, and so we need that to keep happening, and we need to keep putting the spotlight on the need for those efforts.
Yeah, no, that's fantastic. Oh, this is so exciting. So another question here is, can you share more about the growing body of research that links patient outcomes with the race and gender of the providers?
Yeah, you know, I think that, you know, what we have so far are these observational studies. You know, we have them around gender. There was a very large trial in Florida a few years ago that showed that the gender concordance and discordance of physicians actually influence the outcomes, especially with male physicians and female patients with acute MI. And we know there was a recent study looking at Black infants having a higher, or less high mortality rate when their physicians or neonatologists and pediatricians were Black. And so, obviously there is something there. I just want to be, clear that, we live in a society with racism and sexism, and we are, people breathe in this messaging. So even if you explicitly do not, endorse these ideas, the fact is that they're in your subconscious, and we know that affects how patients receive care. It's been very well documented.
Well, I couldn't agree with you more. And it's again, it's a question of, it's a matter of incorporating the data with these stories, because there's so much that I know, I can speak for myself. There are things that I said, behaviors, nonverbal communication that I didn't even know, I wasn't even conscious of it. So that it goes back to the unconscious bias. And I couldn't agree more. Uche, Dr. Blackstock, thank you so much for sharing your incredible experience and expertise with all of the viewers. I'm so grateful to you.
I'm so grateful to you. And I'm so glad that we could connect on this platform. This was a lot of fun. Thank you.
Well, thank you. And I also want to take time to thank all the viewers watching. And I want to thank Aspen Ideas Health 2020 for creating this incredible platform to have these open conversations. I'm hoping this will be the first of many, many more to come. So thank you.